So we know that there are gender differences in multiple sclerosis. It's 2/3 of the patients with multiple sclerosis are women, and the incidence of multiple sclerosis in women increased since the 70s. Therefore, there was always a question how other features of the disease affect men and women differently. And because we have the Danish Multiple Sclerosis Registry, which has collected data on people with MS of almost 70 years, now we thought that we have enough follow-up data to compare a large cohort or men and women or male or female patients with MS to see whether there is difference in the onset symptoms, relapses, and disability development. We followed the cohorts in 1996, so we had a complete cohort which were followed for more than 25 years. So we compared about 3,000 males with about almost 7,000 females. Of course, there was a slight difference in the baseline characteristic, which was expected. So female had a slightly younger age at onset and a slightly higher relapse rate at onset. Therefore, we have used the method of propensity score analysis, where we stabilize with the inverse probability treatment weights to make the groups comparable. And then we found that through the whole period, the frequency of relapses measured by the annualized relapse rates were higher in women than men. And here is coming the interesting part, until the age of 50. So until the age of menopause. So the higher disease activity of the inflammatory component expressed by relapses is only present in females until the age of menopause. So that was the relapse rate. And then we also measured, of course, EDSS, because just to explore whether that male has more progression, is it a reliable belief or not? Yes, we can see that through the whole period, the mean increase in EDSS per year, it's a bit higher in males than females. However, it starts at the age of 45 in men. So it's we have investigated time to confirmed and sustained EDSS 3, 4, and 6, and we can see that through the whole observational period, the risk of obtaining these EDSS milestones are higher in men than women. So, and with that, we can conclude that we conducted a nationwide population-based large study, including all MS patients in Denmark. And we actually quantified the sex differences in the inflammatory and neurodegenerative component of MS development. And I would say the paper is out today. It's an open access paper at the Journal of Neurology, Neurosurgery and Psychiatry at the GLNNP. So everybody can read the quantitative differences in relapse rates and EDSS developments. So we can see that women have more inflammatory component in disease activity in terms of relapses than men up to the age of menopause, which indicates that sex hormones also play a role in the development of multiple sclerosis. I think that when we talk about personalized treatment in multiple sclerosis, the first thing we always have to take into consideration is gender and age. And if we do that we already a step forward. And then I think we should really look at more thoroughly, there's already a focus on it, how hormones, the interplay between the sex hormones and the immune system.